Hello everyone, my name is Abdulrahman Nanah, and today we're going to be talking about the relationship between depression and cancer. So, as we all know, the diagnosis of cancer can bring about a great deal of distress to the patient. So, unsurprisingly, depression, anxiety, and other mood disorders are common comorbidities that can affect cancer patients. It was previously thought that these mood disorders occurred as a result of the reaction to the diagnosis of cancer. However, recent research suggests that this relationship can actually be a lot more complicated, particularly in the case of pancreatic cancer. So, in pancreatic cancer, the incidence of depression is actually higher than that of other intra-abdominal malignancies, with some reports mentioning that the depression actually starts after the diagnosis of pancreatic cancer, while other reports mentioning that surprisingly, the onset of depression can occur up to 6 months before the diagnosis of pancreatic cancer. And so this sparked about many theories between the cause and effect relationship between depression and pancreatic cancer. Some people were mentioning that pancreatic cancer can secrete some chemicals that lead to depression, somewhat of a paraneoplastic syndrome. Other people, on the other hand, were mentioning how depression can weaken the body's immune system, predisposing the body to pancreatic cancer. And so therefore these people will mention depression as somewhat of a risk factor for pancreatic cancer. And one last theory is that both pancreatic cancer and depression can cause an inflammatory reaction within the body. And so this leads to pancreatic cancer increasing the risk for depression, and at the same time depression increasing the propensity for pancreatic cancer. So it becomes somewhat of a bidirectional relationship. So while the causal relationship is still not clear and research is still going on, a relationship certainly does exist, and it shows us the importance of identifying the mind and the body as one, because psychiatric disorders and somatic disorders, in this case, particularly in pancreatic cancer, can sometimes merge together. So for the future doctors who are watching this video, I want to leave you with one final message. While a definitive cause is still not clear, if a patient presents to your clinic with abrupt onset, unexplained, unprovoked, sudden onset depression, keep an eye out for somatic disorders. For example, any cancer, in particular pancreatic cancer. Thank you all for watching.